Dr Nkhensani Nkhwashu, Executive Manager of NSP Implementation at South African National AIDS Council, joins us for an expansion of this topic. A very good evening to you. Thank you so much for your time. I mean, you were speaking to one of my colleagues earlier today about the importance of the community when it comes to curbing these really frightening numbers. I mean, we're talking each year an estimated 50,000 new HIV infections among children and adolescents in the country. What are the contributing factors?
Thank you very much for having me, and good evening to all the listeners. Most of the contributing factors is that, when you look at HIV and the way it is transmitted amongst us as human beings, there is still a taboo. In most cases, you'll find that it's not something that we speak about. It's not something that, as parents, we discuss it with our children, or also again, that as guardians, it becomes, it's normalized, within the conversations that take place in the household. And, especially when it comes to the issues of sexuality and the issues of, that are related to sex and the way we behave amongst each other. It's still something that it's in our cultures that we really don't talk much about that. So if we don't talk much about sex, and you find that in parents, we don't also discuss sex with our children, or also even amongst each other, having HIV amongst us for so many years, we don't say anything to each other. So those are some of the contributing factors. And also additionally, one of the contributing factor again is the issues of access. You'll find that, we know where we can go and access condoms. We know where we can go and access messaging. But because, of poverty and all other environmental factors that plays a key role, you find that, I'm struggling to go and get access or to get condoms in the designated areas. And also the issue of education. Education, just an ordinary understanding as to how to use a condom and what are some of the interventions that we can put in place as individuals, and also an understanding that. So all these other issues, they also contribute to the spread of HIV amongst each other. So when we talk about ending HIV or AIDS in children, it's something that we as community members, we really need to take it seriously, because government and key stakeholders have made provision that treatment is available for free in public health facilities. However, we still find ourselves, we faced with challenges of accessing all these good services that we have.
You speak about culture and, the lack of normalizing conversations around sexual education within households. How do these conversations begin? How should they begin, when a parent or a guardian notices that, there's an adolescent in the house and they're growing? What approach should be taken to not humiliate but educate?
Yes, that is something that, as parents, as we have mentioned, that when you start to realize that your child is at a knowing age, we know the behaviors of our children. It calls for us as parents and also as guardians to have a necessary sit-down conversation with that child. Because if we don't do that, our children will be taught outside there by social media. And some of the, the things that they pick up outside there, you find that it's not the correct information. So we call all the parents, we call all the guardians, and we call on the community, especially the key stakeholders, to say, let's talk. Let's normalize this. In our culture, we say is that, it takes a community to build or a village to build a child. So hence we are saying it starts there at the community level and also inside the household. That let's have those difficult conversations. Talk about with your children to say, HIV, it's a killer. HIV is transmitted. Discuss those transmission modes with your children. Discuss them to say that you can protect yourself against HIV. And also, let's talk to our children that, when now you are at an age where you'll be starting to have sex with your partner or with your boyfriend, these are the things that you can use, like, use a condom I always say that no, a condom is king, because it makes you to be empowered, and it makes you, to make informed decisions. So that's why we said, let's start there. We know our ages, we know that the ages that our children, they are starting. Some of the parents, you can even pick up that this child is now starting to have boyfriends. You can even listen to the kind of talks that they are talking. So we call everyone, and especially we say to parents, let us be parents. Let us talk to our children. A parent is not only someone who have given birth. As a parent, is an elderly person who is able or capable to guide an individual. We say, hey, let us rally together as communities. Let's talk amongst each other, and also let's talk amongst the teenagers, because it's not only HIV, but will also assist us also with curbing teenage pregnancy.
What are some of the notable trends pointing to these high numbers? I mean, you make mention of education being an important part of it, but what we have heard from some of the teenagers who've fallen pregnant is that the pregnancies are becoming a norm in communities. So what are some of the notable trends that, of course, need even greater intervention if teenage pregnancy is now becoming a norm?
Some of the trends that we are seeing, you can also associate teenage pregnancy with some of the children who are dropping out of school. They drop out of school, you don't go to school anymore. What are you doing when you are at home, or what are you doing during the time that your peers are outside there, getting education? So we can say we also associate it with dropout from school, and also we associate it with bad behaviors. You find that that child is a child who normally not go to school as required, or a child who has become difficult at home. And also some of the trends that we're picking up with when we talk to them, you'll find that a child will even tell you that, my friends, I have been influenced by the type of friends that our children hang around with. And also others will even mention the issue of the impact of social media. And again, the impact of poverty, inside in our household. As you have mentioned, some of the children that were, or the teenagers that we were with today, some of them will even highlight even the behavior of us parents, which has become normal, that they find themselves raising themselves up, and others even being responsible for their younger siblings. So that puts these teenagers at a very, very difficult situation, because now they start to see themselves also as parents. And as a parent, they want to cope and also behave as parents. Then they also start to have a boyfriend. Yes, there were a few of them who have indicated that they are involved with men who are older than them. But now this teenage pregnancy, we're starting to see it more amongst people of the same age, not necessarily having a big gap between each other. So the behaviors, not going to school, bad friends that they are hanging around with, and also the type of talk, the language that they talk. It's some of the key things. Those things needs to be the red flags. When you start to hear that your child is not going to school properly, when you start to hear that your child is coming back late, even if they come and say that, no, we have some extra curricular things that we're doing, find out, be interested as a parent. And also be interested as a parent when you see your child spending a lot of time, on social media or on the phone.
Very well. Thank you so much for weighing in on this discussion there. We leave it with Dr Nkhensani Nkhwashu, who's the Executive Manager of NSP Implementation of South African National AIDS Council. Of course, just giving us a little bit more detail around the high numbers of children and adolescents in the country being infected with HIV.